Hello, I am Dr. Mirela Cherneyanu, and I welcome you to the Wellness Optimizing Warrior MD podcast, the WOW MD podcast. I am not your typical wellness coach, and this is not a typical wellness podcast. Here, I'll discuss educational facts about health, hormones, intimacy, anti-aging, and beauty trends, all very hot topics, to empower you to make great choices when it comes to your health and to your body. I want you to go, wow, I did not know that. Or, wow, this is going to make a great difference for me. Our healthcare system is broken and it needs a revolution. You and I can start one today. I am willing to share my knowledge with the world if you're willing to listen. Let's get started. Hi there, and I am so excited to talk about today's topic, which is going to continue what I spoke about in the last couple of episodes, but there was a lot about health insurance and how you can protect yourself by not needing to use health insurance and staying healthy. And today's topic is more about wellness exam. And I'm going to go through for the next couple of episodes and talk about wellness exam. And I'm going to continue to give you information about best practices for wellness exam so you can judge your doctor immediately whether or not he or she is a good fit for your goals and your needs, or your child's goals and needs, or your parents' goals and needs, depending on what the situation is. So I would like to start discussing women's wellness exam, but if you're a man and you're listening to this episode, please keep listening. I will also address male physical wellness and optimal markers for male health. But as women's health needs are highly underserved, and there's a lot of confusion about a womanly physical, a woman's general wellness exam, I would like to start with the ladies, okay? And I'm going to start with the young ladies. So if you're a woman or a man, regardless, if you have a daughter or a young woman that is close to you in your life, then you probably want to listen. So I'm going to start a little bit by talking about how there's a little bit of a confusion about women's wellness and then a woman's general physical. So we are told that a woman needs a pap and a breast exam done by a gynecologist or a GYN doctor, or maybe a mid-level that's affiliated with an OBGYN practice, and that she also needs a general physical with her primary care doctor, otherwise known the family practice doctor, or sometimes an internal medicine doctor, or sometimes it's an OBGYN that acts like a family practice doctors. So we are trained, and I'm going to say a little indoctrinated, by whether it's education in residency or by reimbursement rules made up by health insurance companies, that there might need to be two physical exams, womanly physical exam and a general physical exam for a lady. Now, it is great that we can use this grace, and I say grace with air quotes, but I know you can't see me, the grace of allowing two physical exams under preventive care. And we should take advantage of it because women have many needs that are not met. And we, the women, should take advantage of as much healthcare preventively as possible, especially as we approach and turn the corner past 40 when things start to get rocky with our hormones. Now, I personally believe that your womanly exam should be so much more than a pap smear and a breast exam, especially as you pass 40 and you enter perimenopause. Yes, you heard it right. Most women enter perimenopause in their early 40s. So after 40 years old is a very delicate time for women. But I do want this episode to be about all ages. And I would like actually this episode series to be about all ages. But I would like to start with young women in their teens. And I would like to then move to the 20s and 30s wellness needs, and then 40s, and then 50s to 65 and past 65. Now, wellness needs are extremely different based on age bracket. And as physicians and mid-level providers, we should be trained to look for different markers and landmarks and certain things in the physical exam that are depending on the stage of a woman's life. A young girl, a young woman, a mature woman, or an aging woman. Now, some of these age brackets I just enumerated earlier are simply so it's easier for you to follow, to start, stop, fast forward as needed. But again, if you're a man or a woman, you might have a daughter. You might want to listen to the episode today because there's a lot of information that is going to be useful for your most significant loved ones, the young loved ones. And maybe you know someone that you care about that has a young one that you can share this episode with. So let me talk about teen girls wellness exam. Now, anyone under 20 is in their teens. So technically from age 11 to age 19. But young women between 11 and 16 might have slightly different health needs than 16 to 20 or 16 to 19. So let me take the 11 to 16 age bracket first. This is a very critical time in a young teenager's life as her ovaries start responding to the brain's impulses and the HPO axis. The hypothalamo-pituitary-ovarian connection is now starting to mature, and the ovaries start responding by recruiting eggs and making hormones. So please do not confuse this internal endogenous shift, endogenous means internal, for hormonal production with other things that are also happening prior to this and simultaneous, which is unfortunately a major exposure of our teen girls and boys to the endocrine hormone disruptors from their external environment. That's mainly food and drink sources and other environmental sources, carpets, floors, furniture, etc. I have talked a lot about this in a previous episode, so go back and listen to the one about the dirty diet, the contaminants, the endocrine disruptors, the risk of cancer. Those episodes will have a lot of information about that. But in order to educate yourself more on this topic, you might need to go back and listen to those episodes. The truth is that the transgender rates are on the rise, and there's a big problem facing our youth. They have gender identity issues, which are affecting our teens and their mental health. And the answer might lie in what a mother ate or drank when pregnant and what a child has been exposed to during their childhood. Now, this episode is not meant to delve into this topic in detail, just to inform you that there is an issue that is affecting our children. And yes, I personally don't have any children, but our children are the legacy of our race. And the health and safety of all the children determines the health and safety of our human race. So we all have a vested interest in this topic. So what should you care for or about regarding the health of your teenage daughter? Well, let's start with number one, her height and weight. The body mass composition of a teenager is the top and most important indicator of health that you should worry about, physical health, right? There's a clear relationship between height and weight called body mass index or BMI, and it should be between 19 and 24. That's the BMI, right, for a young teenager. If it's over 25 but under 30, then the BMI indicates that you might have an overweight daughter. And if it's over 30, then she is considered obese. Now, why is this important? Well, because 1 in 6 young girls in America is considered obese, which is 17%. And this rate is on the rise. According to the WHO, the World Health Organization, the worldwide prevalence of obesity more than doubled between 1990 and 2022. That is in just 30 years. We are becoming obese and overweight at an alarming rate. The prevalence of being overweight, including obesity, among children and adolescents aged 5 to 19 has risen dramatically from just 8% in 1990 to 20% in 2022. And again, this rise occurred similarly among both young boys and young girls. In 2022, 19% of girls and 21% of boys in this age bracket were overweight. Again, just letting some numbers and statistics sink in. While just 2% of children and adolescents aged 5 to 19 were obese in 1990, by 2022, 8% of children and adolescents were living with obesity. So we went from 2% to 8%. So if we're talking about teenage obesity, consider that the root cause of it starts in childhood. I will come back in the future with an episode on obesity for young children that you might find interesting, as many women I care for have daughters and sons under 20 that struggle with weight and are already obese. And many young women under 40 are considering pregnancy, and they need to know that childhood obesity starts with the mother, the father, their weight, their diet, as well as their habits of eating and exercising. It really starts with the family unit and the values that they have around food, around TV watching habits, allowing access to electronics for the children to play and spend time with instead of engaging in physical games and activities and so many other things. So anyway, stay tuned. I'll come back to that. But do not ignore this issue. It is critical for the health of your daughter. Please address her being overweight or obese early on without forcing a diet, other than just cleaning up their lifestyle and educating them on the importance of clean food and steady exercise, as well as educating them early on how addictive processed foods are because they taste so damn good. So teach them early on to avoid them completely. Do not feed those foods to them and do not allow them to eat those foods, and explain to them when they're young why those foods are so bad. Again, habits are formed early on, and it is easier to develop healthy habits than it is to change bad habits. So think about that when you hand a young one a digital screen to keep him or her occupied while you're busy doing something. Think about the snacks and the food they eat early on, because changing habits is almost an insurmountable task for a child or a young person. And whether you as a parent might now be fully committed to make a 180 degrees turn, your child or your teenager is likely going to be stuck. And bad habits might have become hardwired in their brain, making it hard on them and on you to change anything. Now, I got distracted. This is not an episode about teen obesity. Stay tuned. I will have one episode about that coming up. I would like to get back on track. So we want our young girls to have a healthy height and weight. And number 2, healthy hormones. So number 2, another crucial health marker at this age is puberty. In girls, puberty starts with menarche, which is the first period. It's a fancy term, but the first period equals pretty much puberty. So at this age, between 11 and 16, a young girl should first and foremost start getting her period. Let's talk about that for a few minutes. If she does not get her period by age 16, that is a problem. 10% of young women should get their period by age 10. That is a little too early, and they are outside of the Gaussian bell-shaped curve. 90% of young girls get their period by age 14. So if their period starts before 11 or after 15 or so, your daughter might be outside of the bell curve. And usually, if at the edges of a statistic, that could be a signal for a potential health issue. So please pay attention. Why is that important? Well, because early puberty is associated with increasing odds of chronic disease, both physical and mental. First period at age 10 versus 11, for instance, doubles the odds of long-term ill health in adult life. Because the earlier the age at the first period, the greater the odds of stress and ill health. With an early menarche or first period, there's a premature closure of the growth plate for the bones. And that can lead to a limitation on final possible height. That's a big deal for young women. First period before age 12, especially before age 11, was linked to an increased chance of obesity, insulin resistance, and high cholesterol in adulthood, which can increase the likelihood of hypertension, heart disease, stroke, and diabetes in a mature woman. The risk of metabolic syndrome, which is a cluster of 4 conditions, obesity, high blood pressure, insulin resistance, and abnormal lipid profile, was increased by 50% with an early first period. Again, another important reason why we don't want early first period is because an early first period is associated with a higher female cancer risk. The risk of breast cancer is 20% higher when a young girl has a first period before 11, and the risk for uterine cancer, it's about 40% higher. Here's another problem. Early first period is also associated with early initiation of sexual activity, earlier marriage, earlier pregnancy, and certain sexually transmitted infections. This makes the young girls that have such an early age when they get their first period more vulnerable to chronic disease, to infertility, as well as earlier menopause. There are also some chronic psychosocial problems associated with early menarche, early first period, like anxiety and depression, a higher chance of drug abuse, bulimia, bullying, smoking, and suicidal behavior during teenage years. And interestingly enough, premature menopause is more likely when a young girl gets a period early because she will start egg recruitment early on and likely run out of eggs faster in her mid-40s or early 40s. So why could this be happening to a young girl? Why could a young girl have an early first period? Well, the accumulation of endocrine disrupting chemicals, EDCs, likely is what predisposes a young woman to early first period and chronic disease. There are some internal pathological issues that can happen occasionally, rarely. That's why consultation with an OBGYN or that specializes in these things or a pediatric endocrinologist early on to understand what is going on, it's probably crucial. In addition, increased estrogen exposure with early first period might actually explain the increased risk of metabolic and cancerous disease because the fake and synthetic estrogens act on multiple tissues, the brain, the fatty tissues, as well as a young girl's reproductive organs, breast and uterus. So the third marker to watch for when we do a wellness exam for a young girl and when you go to the doctor, it's the physical health and lab markers. So let me talk about those for a few minutes. The general physical health markers for young girls and young boys is pretty simple, but somewhat complicated. Now, I'm not an expert in this. This is something pediatricians are mainly responsible for. But I do get to see a lot of abnormal development of young girls suffering from major period problem issues, PCOS, and ovarian cysts. So I'm clearly familiar with what normal should be. So I will simplify it for you, as that is the goal of this podcast. And I'm going to outline 5 physical health markers you should ask your doctor to check or consider checking. Number 1, growth markers are crucial and should be tracked and charted regularly and plotted against the normal growth curve. Height and weight. Remember, I started with this, and this is really important. Number 2, blood pressure. High blood pressure in children and adolescents is a growing health problem that is often overlooked. Children should be screened for elevated blood pressure annually, apparently beginning at age 3, and at every visit if there are risk factors present. And guess what's the first risk factor? The most important one, obesity. You got it. You guessed right. Number 3, vision and hearing screenings. They're very important, should be done at least annually in a developing teenager. But if there's any kind of behavioral issues, consider doing them more frequently and getting second opinions because hearing problems can lead to behavioral problems. Number 4, dental check. Now, I know this is not medical and it's dental, but it's the general health. It is very important. It should be done by a dentist regularly, at least once a year, ideally in the developing and growing body of a teenager or a young girl or boy, probably every 6 months. And last but not least, let's talk about some lab work that might be important in checking. You want to have your doctor check for anemia, thyroid health, kidney and liver health, and vitamin levels. Unfortunately, vitamin levels are constantly ignored. but they are very telling about a young teenager developing body and their health. So please at least ask the doctor about checking iron levels, B12 levels, and vitamin D levels. Also, if there's any kind of hormonal issues, ask the doctor to check a comprehensive heavy metal panel, which is a simple urine sample test. You might be surprised. There's also lead levels that can be checked in the blood, and a lot of young men and women, young boys and girls with autism can actually just be explained by high lead levels or some kind of chemical that's actually circulating in their bloodstream that they're exposed to that's affecting their brain health. So to recap, the top 3 issues for a young developing teenager woman are the body composition, the puberty and hormonal development, and the physical health and laboratory markers that I just talked about. Now, I do not want to ignore the next super important health issue to evaluate in a developing teenager, which is mental health and possible problems related to mental health. Now, why is this important and why I want to talk about this? Well, let me review some statistics with you. According to the CDC's Youth Risk Behavior Surveillance Data Summary and Trend Report, from 2011 to 2021, that is the last decade. In 2021, more than 42% of students felt persistently sad or hopeless, and nearly 1/3, which is 29%, experienced poor mental health. In 2021, more than 1 in 5, that's 22% of students, seriously considered attempting suicide. And 1 in 10, which is 10%, attempted suicide. So this data brings into focus the level of mental distress many young teenagers and developing future adults are experiencing. And that is a problem. Adolescence is a crucial period for developing social and emotional habits that are important for their well-being. And this includes adopting healthy sleep patterns, exercising regularly, making healthy food choices. Also, developing coping, problem-solving, and interpersonal skills, and learning how to manage emotions. Obviously, protective and supportive environments in the family, at school, and in their wider community are extremely important. Globally, worldwide, 1 in 7 teenagers in this age group of 10 to 20-year-olds is experiencing a mental disorder. Mental health is a top health concern because depression, anxiety, and behavioral disorders are unfortunately among the leading cause of illness and disability among adolescents. Suicide is the 4th leading cause of death in older adolescents, 15 to 19 years old. And poor mental health in adolescence is more than just feeling blue or feeling down. It can impact many areas of a teen's life. Teenagers with mental health issues may struggle with school and grades, with decision-making, and their overall health can be affected, as mental health problems go often hand in hand with other health and behavioral risks, like increased risk of drug use, increased risk of experiencing violence, receiving or inflicting it on other people, on other teenagers, and higher risk sexual behaviors, which can lead to sexually transmitted infections, HIV, and unintended pregnancy for young teenagers. And this leads me to behavior and health. Behavior that is not healthy and risky, but not infectious or chronic disease, is the leading cause of morbidity among adolescents. So I'm going to repeat that. Unhealthy behavior or risky behavior, or both, is the leading cause of morbidity among adolescents. The use of alcohol, tobacco, illicit drugs, and carrying a weapon are adolescent behaviors that pose serious risk. So the consequences of failing to address mental health conditions will extend to adulthood and will impair both physical and mental health and unfortunately will be limiting opportunities for these teenagers to lead fulfilling lives as adults. Let me talk for a few minutes about markers for general health check in a young woman that's age 15 to 20. Now, this is a critical, delicate age when a young girl turns into a woman. So center stage for any health check should include a hormone balance. So please ask your doctor about checking a young girl's hormones. I am a big proponent of checking hormone levels every 1 to 3 years, depending on the age a young woman has. And those still developing and maturing, the hormone levels for a young woman and a young man at the critical age of the late teens until early 20s is a great indicator of their overall health. If a young body, a young developing teenager, is healthy, then the balance and levels of various hormones, including the sex hormones, should be optimal. Again, not in range of what the lab says, but optimal. I'll dedicate a whole podcast episode about the range of lab tests and give some examples, but I'm not going to dwell on that right now. Just remember, talk to your doctor about what's optimal for that age range. Later in life, a man or a woman will start experiencing health issues related to hormone problems, especially sex hormone problems. So when we try to restore normalcy and strive for a certain goal, and we try to monitor lab values, those are very easy to follow and interpret. So we started with a problem, we had low values, we're initiating an intervention, now the hormone values are changed. The changes are easy to look at and monitor and interpret and discuss with the patient. However, if you do not have a comprehensive health check, including sex hormones check, in your late teens, mid-20s, late 20s, early and late 30s, etc., then what is your actual reference point? You don't have one. You have no idea what your levels were when you were at the peak of your health in your early to mid-20s, for example. So obviously, this will not apply if you are not at the peak of your health, or if you're taking a hormonal birth control pill, or you're using a hormonal birth control method that is known to cause an imbalance of your own natural hormones. So all the other healthcare markers that I previously mentioned are valuable and important in any wellness health check. Height and weight, body composition, that is the proportion of muscle mass to fat, the blood pressure, the heart rate, perhaps the abdominal circumference measurement if somebody is overweight, a mental health evaluation questionnaire, and again, last but not least, a comprehensive blood workup that should include evaluating the health of the liver, the kidneys, a complete blood count, which is very valuable to look at, anemia, as well as other markers for the health of the immune system, a complete thyroid check, ideally including Hashimoto antibodies, as autoimmune thyroiditis is very common in women, and it will have no signs and symptoms for many years. Checking nutritional status by looking at vitamin B12, vitamin D3, and iron levels, and other nutritional markers would also be very useful. And then, last but not least, digestive health evaluation is very important in young women. So ask yourself, how many doctors really ask probing questions and linger on digestive health? Not that many. So let me talk about another overlooked and either never or rarely discussed, investigated, or addressed health issue that affects more and more young women nowadays, which is IBS. It is estimated 1 in 5 young women suffers from an intestinal disorder, and it is likely that over 70% of all IBS or IBD, which is inflammatory bowel disease, happens in women. Why in women? Well, it depends on what statistic you review or what explanation it's offered. But there is a chance of anywhere between 20 and 50% that a young woman between 18 and 25 will experience feelings of sadness, anxiety, or depression. And this number is on the rise compared to 2 to 3 decades ago. I spoke about this a little earlier on. Now, this is most likely related to digital technology exposure, as well as toxic exposure to environmental chemicals that disrupt hormones and affect mood, and changes in the parental unit, divorced couples, unstable environment, etc. Also, what's interesting is that women are much more likely to experience anxiety compared to men. Various reasons for that. They're more likely to ruminate when faced with stressful situations. They keep thinking about the situation over and over and over again. And in general, women and men tend to use very different coping strategies, and that applies to teenagers too. Women that are faced with life stressors, including young teenage women, are more likely to continually think and ruminate about them, talk ad nauseum to their friends about it, which unfortunately can increase their anxiety. Whereas young men, early on, maybe it's the environment or the personality or the testosterone, they engage more in problem-focused coping strategies, looking for a solution to solve whatever problem or stressor they're facing. There are lots of studies suggesting that women are more likely to experience physical and mental abuse than men. And unfortunately, this type of abuse has been linked to development of anxiety disorders. Again, there's a very strong link and connection between mood disorders and digestive health. So very anxious or anxiety-prone or sad young women will be more likely to experience digestive issues and IBS, which will lead to nutritional deficiencies. And those will exacerbate anxiety and depression because vitamin B and vitamin D vitamins are crucial for normal mental health. So it's a vicious circle. We need to break that and we need to look into it. Otherwise, we will never address it. Many women also use birth control pills for birth control, which unfortunately annihilate their own sex hormones, causing something similar to a chemical menopause, which means that they experience very low estrogen and very low testosterone. And both of these two hormones are crucial for normal mental health in women. There is a very large number of women, young women, who are noticing severe mood changes after starting birth control pill use. And actually have to stop them because they either experience severe depression or severe anxiety or severe irritability. So in a nutshell, please be aware that there's a very large body of evidence linking mood issues with digestive health problems. And these two issues should be taken very seriously at a young age and addressed promptly. I would like to thank you for listening so far because this, in my opinion, is a very pertinent and interesting topic. And I will continue next week when I will shift gears and talk about young men and continue talking about wellness checks, young men, adult men, and then we'll come back to women. So please listening. And if you feel that this episode has been useful to you, please feel free to share it with someone that might benefit from listening to it. Again, thank you very much. Thank you so much for listening. If you are one of my faithful listeners and you are finding value and enjoying these episodes, please feel free to leave me a review on whatever platform you're listening to. Also, if you find the content in these topics useful, not just to you, but to someone else, a friend, a loved one, or simply an acquaintance that you know could benefit from the knowledge I share here, please feel free to forward my podcast to them. If you live in California and you'd like to work with our practice to help you achieve your wellness goals, please go to our website, www.herabeautyandwellness.com, and request an appointment. It will be our privilege to help you in any way, shape, and form we can. Any suggestions on a topic of beauty, wellness, or anti-aging are welcome. All you have to do is go to the website, leave a suggestion into the AI chat, and I promise you if you ask, I will listen and add your suggestion to my list of topics that I want to get to as soon as possible. Please join our Facebook group, The Wellness Optimizing Warrior MD. It's a small growing community that focuses on wellness, on what's new, what's safe, and what works in beauty, wellness, and anti-aging.